on March 17th, St. Patrick's Day of 2020, we shut the office down because of the pandemic. So for the next 8 weeks, I did a lot of study and listened to a lot of professional webinars and talked to other dentists, and decided that I needed to make the practice safer and make the patients feel comfortable about coming into the office. The entrance into the practice starts with the patient driving to the office and being in the parking lot, and there's an alert sign on one of our windows that says, "Please call the office." The reason for that is we don't want you to enter the office if somebody else is in the waiting room or if a patient is also going through the entry protocol. Once you enter the office, we ask that you sanitize your hands with the hand sanitizer that is on a stand. And then Beverly's going to hand you some gloves, and we're going to ask you to don these gloves. The reason for the gloves is so that it protects you from touching any countertops or pens or anything where you might pick up something in the office. It also prevents you from leaving any undesirable viruses or bacteria here in the office, so that we can stay as disinfected as possible. Obviously, we'll give them a new mask if they don't have one, but if they have their own, we just let them use their own mask. When they come in the office, we ask them to take the mask off. We'll put it aside for them and give it to them when they leave. Once you've done the hand sanitizer and donned the gloves, Beverly will ask you to fill out a questionnaire. The questionnaire has multiple questions on it, one of which is the important question whether you have traveled anywhere outside the United States. But what we found the most important question is whether you have had a cough or a fever, but more so whether you've had a change in your taste or smell. That is a 60% predictor of whether you have the COVID virus or not. The second thing that we do is we take your temperature. Now, as long as your temperature is below 100 degrees, you are all right to come in the office. If it's above 100 degrees, then we ask you to leave because we think that you might have been infected. We also ask you to rinse with iodine, or if you are allergic to iodine or allergic to shellfish, we have also an oral rinse of hydrogen peroxide. Basically, that's to get rid of any bacteria or virus that's currently in your mouth or in your top of your throat. That protects us, it protects you. When we start the procedure, we're not creating an aerosol that has the COVID virus or any other bacteria in it. We also use the iodine if it's a longer procedure or if it's a procedure that's invasive. We ask you to rinse out with the providone iodine during the procedure. More commonly, we'll do that during your cleaning appointment, but I also do it during a longer procedures where I feel that we need to upgrade your disinfection of your oral cavity. So then you're ready to have your appointment, and the hygienist or me will come out and bring you back to the operatory to seat you for your procedure for the day. The disinfection process, we use a hospital-grade disinfectant called hypochlorous acid. It's a weak acid. It's known to kill the coronavirus and other types of bacteria, often used in the hospital setting. We also use the hypochlorous acid to fog the office. I'll fog the office 3 times a day. A fogger takes the hypochlorous acid and makes a mist out of it. And you aim it toward the ceiling, and it actually drops from the ceiling and dries before it gets to the floor. And it's an air scrubber. It actually will collect the bacteria or the virus that's in the air and kill it. And I'll use the fogger also between appointments. So let's say the hygienists or myself see a patient, then they leave. I'll go into the office and I'll fog the operatory so that we know that we're disinfecting the whole office. Along with the fogger, we spray all the surfaces down with the hypochlorous acid, and then we wipe it down. And then sometimes we'll spray it again with the hypochlorous acid and let it sit. It works within minutes. We get everything as disinfected as possible. One of the things that we do is we have to use personal protective equipment that is upgraded from before. So in the early 80s, I went through the AIDS epidemic era, and at that time, up to that point, dentists weren't wearing gloves and they weren't wearing masks. This is just another upgrade to that whole scenario. So the masks have been upgraded to type 3 masks or N95 or 95 masks. We also use face shields, and of course we're wearing gloves. So all of that's an upgrade from the 80s when all we were wearing were just any type of mask and gloves. It didn't matter what we were wearing as long as we had them on. So everything's been upgraded, and then of course after the appointment's done, we change out, as well as wearing these disposable jackets. We change everything out between each patient. Other than that, it's not that much different for them, except they're looking at a dentist or a hygienist that has this increased PPE, additional masks, and a face shields on occasion. So that's the only difference for them. The whole idea is to make it safe for everybody, both us and for the patients, and so that they feel that they're being well taken care of and they're not at risk for anything. We'll continue the sterilization process by taking all the instruments and putting them in an ultrasonic, which cleans them up, and then we wrap them up, put a biological monitor inside, and then we put them in a sterilizer, and all the instruments are sterilized completely. We also have in the office, along with doing the fogging technique, the misting technique, we have air purifiers running all the time. We have 2 in my office. Because of the square footage, that's really all we need. Each purifier will change the air out and purify it every 15 minutes, 15 to 20 minutes. So the air in the office is changed every 15 to 20 minutes. The whole purpose of what we're trying to do here is to eliminate as much aerosol as we can in the air flow in the office. So where we create aerosol is when we use our hand pieces or our ultrasonic devices that we use to clean your teeth. In order to prevent the aerosol, I have ordered some extra oral suction machines that will go next to our dental chairs. They're basically big vacuums, and the big vacuum has a suction on it that's going to be right next to your mouth, and it's going to take all the aerosol and into this suction machine and purify it before it lets the air out into the operatory air and office air. So those units were back ordered, and they're due in the office in August at the latest. Here at the Toothboss, we're trying to keep you safe as patients and us safe as clinicians. And following these protocols very closely, I feel very comfortable that we're doing that. If you'd like to make an appointment, please call us at 781-335-0604. You can also look me up online at www.toothboss.com.
Bye.
Have a good day.